Chair now calls up H.R. 6163 and asks the clerk to report.
H.R. 6163, to amend Title IV of the Public Health Service Act to provide for a national pediatric research network.
Chair recognizes the gentlelady from California, Ms. Capps, for 5 minutes.
And thank you, Chairman Pitts and Ranking Member Pallone, for bringing up this bill for markup today. The National Pediatric Research Network Act is an important bill to improve research and clinical trials on pediatric diseases, to train future pediatric researchers, and to disseminate research findings quickly so that all children may benefit. And it will add important resources and capacity to research children's rare diseases like spinal muscular atrophy, SMA, and to develop new treatments to fight them. I'm proud to have co-authored this legislation with my friend, Congresswoman Kathy McMorris-Rogers. And I'd like to recognize our colleague, Congresswoman Diana DeGette, for her leadership on this issue over the years. And finally, I would especially like to thank my constituents, Bill and Victoria Strong, for their tireless work on behalf of their daughter, Gwendolyn, and all children with spinal muscular atrophy and other rare diseases. And it's quite noteworthy, I believe, that Gwendolyn just began kindergarten at a public school in Santa Barbara. This family and others have shown how entire communities can come together to fight diseases like SMA. I'm so hopeful that in a similar way we can continue our bipartisan work together on this, in this committee and in the House as a whole, to move this important legislation to the House floor. I urge my colleagues' full support for this measure, and I yield back.
Would the gentlelady yield?
I'll be happy to yield to you.
Sure, thanks, gentlelady. Pediatric research is so important to the health of our children, yet we continue to struggle with unmet needs. By establishing pediatric research networks and consortia, this bill will improve research by coordinating research efforts among participating institutions. Consortia will be invaluable for children's health by focusing on the most pressing needs in pediatric rare diseases. And I want to thank both Ms. McMorris-Rogers and Ms. Capps for their work on behalf of children in need. And with that, I yield back. Are there any bipartisan amendments to the bill? Are there any other amendments? The question now occurs on favorably reporting the National Pediatric Research Network Act of 2012. All those in favor shall signify by saying aye. Aye. All those opposed, no. No. The ayes have it, and the bill is favorably reported.